So what are the common symptoms that the people experience when they have osteoarthritis?
Yeah, so the anatomy itself is like the joint is a very stable joint, okay, compared to the knee joint, which is covered with a lot of ligaments, and the structures it runs on most of the ligaments, not the joint itself. But hip joint itself is a very stable joint. Most of the osteoarthritis now is due to the lifestyle changes which is happening, okay, because we are losing all the activities. We don't do any of the activities now. Our lifestyle has become more sedentary. People sit for a long hours, okay, they don't get up from the seats to complete their work, which is not good for any of the joint, okay. So you have to do your exercises, you have to keep yourself active, keep stretching all your muscles, ligaments. You have to do your weight training so that you can keep yourself active and reduce the chances of arthritis later in life. Rapidly progressive osteoarthritis is a very rare condition.
Voices shaping the future of medicine. Stories, knowledge, experience. More for life.
Hello everyone, welcome to Project Heal. Many people think that hip pain is something that only affects elderly people, but that's not the case. Even people experience pain in their 30s and 40s. Usually they ignore it first, but what happens later on? It affects their daily lives. So, in today's episode of Project Heal, we are going to understand what exactly happens inside the hip joint when osteoarthritis kicks in. We are also going to discuss about a rare condition called rapidly progressive osteoarthritis. So, to help us understand this further, we are joined by Dr. Nithin today. Welcome, Dr. Nithin.
Hi, thanks for having me here. I'm a consultant orthopedic surgeon and a joint replacement surgeon. Yeah, so now.
So, doctor, before we dive deep into osteoarthritis, let us understand what exactly happens between these hip joints.
So yeah, the hip is almost the second. It's the second largest joint in the body, after the knee joint. So it is covered with a cartilage, okay, and it's a ball and socket joint. So it has got a deep cup and a ball which sits into it, and there's a cartilage layer which covers the hip joint. It's a hyaline cartilage. So when there's a wear of the cartilage due to a lot of reasons like trauma, due to age, due to many other factors, when the cartilage starts losing its thickness, then there's a bone and bone contact which causes pain and causes arthritis. So this is a general thing about osteoarthritis.
So now we know about what is the anatomy of the joint, and we also know what is osteoarthritis. So what are the common symptoms that the people experience when they have osteoarthritis?
Yeah, so the anatomy itself is like the joint is a very stable joint, okay, compared to the knee joint, which is covered with a lot of ligaments, and the structures it runs on most of the ligaments, not the joint itself. But hip joint itself is a very stable joint, okay, compared to the knee.
Okay.
Because as I said, it's a ball and socket joint. The femoral head sits into the acetabular cup. Acetabulum is the part of the pelvis where it sits into it, and it creates. There's a labrum layer over the acetabulum which keeps the joint in place, causing a suction effect.
Okay.
So it's very stable, and there's a cartilage layer over it. Okay. So it is one of the most stable joint, and plus it is covered with a capsule and surrounding muscles, ligaments, which protects the joint itself. So a joint itself is a very stable joint.
Okay,
But,
maybe
yeah.
that's why I assume that it is able to bear all our weight.
Yeah, so the hip joint itself bears almost, they say, almost 1.8 to 5.5% of your body weight during running and all the other activities. Okay. It bears that much amount of weight during all the activities, whatever you do in your day-to-day life.
Okay, so one question, doctor. So if obesity happens when the person's weight increases, so that also affects the osteoarthritis or causes?
So most of the osteoarthritis now is due to the lifestyle changes which is happening. Okay, because we are losing all the activities. We don't do any of the activities now. Our lifestyle has become more sedentary. Our
Okay.
food habits has changed.
Yeah.
Our the obesity has kicked in.
Even the corporate
Corporate,
lifestyle.
yeah, the
Yeah.
corporate lifestyle. The people sit for a long hours. Okay, they
Yeah.
don't get up from the seats to complete their work, which is not good for any of the joint. Okay, so you have to do your exercises. You have to keep yourself active, keep stretching all your muscles, ligaments. You have to do your weight training so that
Yeah.
you can keep yourself active and reduce the chances of arthritis later in life.
Especially if you have a working lifestyle when
Yeah.
there is a long time you are sitting in
Yeah,
front of a
long time
computer.
sitting in
Yeah.
front of the computer and other things. Now
Yeah.
even kids have stopped going outside and playing. They sit
Yeah,
in front of
exactly.
the computer and play games. So all that is leading to the next generation, leading to all these obesity factors and all the other things.
Yeah.
But some of the obesity is due to hereditary, which should be managed medically.
Okay.
Other than that, which is lifestyle dependent, has to be changed. Your lifestyle has to change. Your food habits have to change. You have to eat good, nutritious food. You have to do all your activities regularly,
Yeah.
not once in a blue moon. It's like you have to do every regular. So you keep your not only the hip, all the joints healthy. Otherwise, each and every joint slowly will go into arthritis or
Yeah.
other changes, so the cartilage damage and all the other changes which is happening, which later leads to arthritis.
Okay. So what are the common symptoms or what patient experience when they
Yeah, so
have this?
the common symptoms of because we are talking about the hip, the
Yeah.
common symptoms is a groin pain.
Okay.
Patient
What is the
complains of
groin
pain.
exactly, doctor?
Groin is the region around the hip.
Okay, yeah.
So because the hip joint sits deep, but it sits in front of your pelvis. So there are few nerves which connect to the other structures like the femoral and obturator nerve,
Yeah.
which gives to the hip and to the groin region that's around
Yeah.
the hip area. So and it comes to the knee also. So
Okay.
people sometimes come and tell us, okay, we have a knee pain, but
Yeah,
usually it's not a knee pain. It's just a
Okay.
radiating pain from the hip, which
Okay.
causes the groin pain itself is not due to the knee, but it's due to the hip problem.
Okay. People confuse between knee pain and the hip pain.
Yeah. So the groin is in the inguinal region. So the hip joint sits behind the inguinal crease. So what happens is that is a place. So because of this nerve distributing to the hip and to the other area, so we have the pain which radiates to all this part. Okay, and they have something called a morning stiffness as well. Okay, morning stiffness is when the joint is inactive for a long period of time. There's an effect called a gelling effect because the cartilage tends to become thickened. Okay, and it gets stuck. So morning when you get up, there's kind of stiffness. You cannot move your joint. Okay, this might not occur in an early arthritic stage, but a later stage, people tend to tell, okay, we have morning stiffness. Okay, and if the stiffness persists only less than 30 minutes, then it is due to a regular osteoarthritis. But if it is persisting even after more than an hour after getting up in the morning, then you'll have to check for other causes like inflammatory cause like rheumatoid and other things. Okay, so morning stiffness is one pain, and you have pain and during all the activities like sitting down, sitting cross-legged. All that is the main common symptoms which patients come and tell you, people who have osteoarthritis.
Now we understand that groin and knee pain, also the morning stiffness. These are the symptoms of osteoarthritis. What is the reason exactly? Why is it happening?
So that's what. As I told you, the hip joint is covered by a hyaline cartilage.
Okay.
Not only the hip joint, even the knee joint is covered by an hyaline cartilage. So once there is a wear and tear of the cartilage due to so many reasons, like it can be due to trauma, due to childhood diseases, like there are congenital diseases, there are hip dysplasias, there are diseases in the child where there's a disease called Perthes which causes the damage of the hip joint due to the old age.
Even aging.
Aging also, there's a loss in the cartilage, thickness of the cartilage. When the cartilage gets depleted, there is bone and bone contact, and the fluid which is formed due to the cartilage which is there, which is also lost. So then there's a rubbing of the joint with each other, like the ball and the socket gets they rub on each other, and that causes pain. There is something called an osteophyte formation.
Okay.
Okay, because of the extra bone growth, there's an osteophyte. Osteophyte is a extra bone which grows. In a normal osteoarthritis, there's an osteophyte formation. So that causes not doesn't allow the joint to move freely.
Okay.
Okay, when the patient starts straining or moving or walking because you have to put the load on the hip joint, there is pain. So that is the main reason for pain during osteoarthritis.
So, doctor, what are the treatment options available for osteoarthritis?
So like people think, okay, everything is not surgery. Okay, but the early stages of osteoarthritis, when you see there's a thinning of the cartilage, whether there's a joint space reduction, all that we tend to give physiotherapy, exercises. We can give anti-inflammatory drugs for some time, and then ask them to keep themselves active. Okay, and if there is, like you said, if there's obesity or if there's weight gain, ask them to reduce weight. Lifestyle modifications, eat good, nutritious food. Okay, all that is the first line of treatment. And if the arthritis progresses slowly, okay, if it is an osteoarthritis, means it's like arthritis due to the age, it'll progress slowly. It might take decades, like it might take some time for the arthritis to develop. Okay, then by the time if you keep yourself healthy, it will take some time to. But if it is due to some other cause, like inflammatory, it might progress faster. And if it is progresses and it reaches a stage where there's no movement, there's restriction of movement, and the cartilage is totally worn off, there's no joint space, patients are not able to lead their normal day-to-day life, they're not able to do their day-to-day activities, like they're not able to go to the washrooms, they cannot go outside, they cannot do their work on their own, or they require a support. Then that is a stage when we suggest surgery. Okay, so the surgery is called a hip replacement. So we replace the cup and replace the head, and it runs on it is a metal cup which we put and a metal head, and in between there's a plastic. Okay, it's all a polyethylene, so it runs on that.
Yeah. So, from the viewer's perspective, so they must be wanting to know what if they have set of symptoms and which treatment method should they go for according to the symptom.
It is not the patient to decide. I don't think the patient can just say, okay, I've got pain and I'll go for this symptom.
What I'm trying to ask is, if it is a minor pain,
Yeah.
or if I am having severe pain, you must be suggesting different
Yeah,
treatment
so
options.
if the pain doesn't get relieved on its own, if the pain persists for more than 2 weeks or 3 weeks, then it's better to consult a doctor. Okay, and then take his opinion, consult a specialist, consult a ortho surgeon, or consult a joint replacement surgeon, or just consult him, and then ask him. Then you let him examine, let him see what it is. If you let him take an X-ray and find out what is your problem. Okay, if he feels it's just a muscle strain or a muscle, like you don't have any problem, you can just go about with your normal activity, do your stretches, do your activities. So it is not only the symptom. The symptoms might be due to a lot of reasons. Like pain can occur due to a lot of reason.
So, how is the clinical evaluation of osteoarthritis done?
So clinical evaluation is, first you'll have to examine the patient. When the patient comes, you have to examine. Like I told you, patient might tell it's a knee pain. They tell their pain in the thigh and all that. Then you have to examine all the joints. Then you take an X-ray. Okay, we take an X-ray. X-ray is the first means to confirm osteoarthritis. To see changes in like what I told you, the joint space reduction and the cartilage damage and all that. We don't see the cartilage damage itself, we can see the joint space reduction, or if there's a later stage, then you can see osteophytes and you can see all the other changes related to arthritis.
Yeah.
Okay, if it is a younger patient and there is damage in the head, then we'll have to rule out a lot of other things, like it can be avascular necrosis, there's an entity called avascular necrosis, where the blood supply to the head decreases, and then there is damage, because when there's no blood supply, the head starts getting resorbed.
Yeah, that sounds dangerous, by the way.
Yeah, so that is usually seen in younger patients,
Okay.
usually due to drug abuse,
Oh.
like taking a lot of steroids, like or due to like lot of anti-inflammatory and lot of drugs for a long period of time.
Okay.
Okay, and then it can be due to idiopathic as well, because without any reason also that can happen. Okay, so that is to rule out all these things, we might require an MRI as well
Okay.
if it is found early.
Yeah.
Okay, if a patient comes in 50s and 60s with the hip changes and hip damage, then I think X-ray would be fine. unless you have a lot of suspicion, because that then we can relate that to osteoarthritis, that is due to age. Okay, if it is a younger patient with arthritis, then we have to rule out a lot of other things.
So, doctor, what are the treatment options available for osteoarthritis?
As I told you, the final stage osteoarthritis, only treatment is a hip replacement surgery. Okay, the initial stages is like I told you, you do all your lifestyle modifications, you do reduce your weight, do your physical activities, increase your muscle strength, physiotherapy, and if you have a lot of pain, might be anti-inflammatories and all that. Okay, but if the stage progresses and when there is no joint space left and there is complete damage of your cartilage, there is the osteophytes which is blocking the hip joint, then it is difficult for the person to even walk or sit down and do his daily activities. So even from getting up from his sitting position will be a difficult task. So that is a stage when we advise a replacement, irrespective of the age. Okay. So in younger people, in conditions called avascular necrosis, they also will have to undergo. If the avascular necrosis actually is very rapidly progressive, so that also when it goes into osteoarthritis, the treatment is hip replacement. Okay, and nowadays hip replacements are very successful surgeries. Patients are really relieved of the pain. Surgery is done to relieve your pain and increase your mobility. Okay, and patients are made to walk, made to do all the activities, except for we don't allow them to go for any sporting activities.
So, after the surgery, they cannot go
Go for any sporting
Okay.
activities like jumping, running, and that and all is long term will affect your hip joint, and which can go into revisions. Like again, you might have to replace the joint again, second time. That's called a revision surgery. Other than that, doing the normal day-to-day activity, they won't have an issue.
What is the procedure of this surgery? What is done in the surgery?
So that's what during the or like when the patient comes to you, you'll have to first diagnose, okay, and find out whether hip artery that patient doesn't have any other condition. Especially in younger patients, it's very important to rule out what is the reason. So we have to find out what is the cause. I have a patient who has got something called an alkaptonuria. I don't know whether alkaptonuria is something disease where the joint gets damaged fast. It is found in 1 lakh people.
Oh, it's that rare.
Yeah, it's a recessive.
Okay.
Doing a hip replacement, saying is easy, but it is very difficult because bones are very soft. You'll have to keep your backups. You have to do a proper study. You have to do an MRI. You have to do other conditions. So all that is required. So like that, each condition, there are a lot of conditions before you go into a hip replacement. Okay, and then once a hip replacement is so what is done in hip replacement is there's a cup which is called the acetabulum. The acetabulum is reamed to the same size and we put a metal cup. Reaming is you remove off all the osteophytes and all the other damaged parts and then you put a metal cup. Okay, and that metal cup can be two types. It can be cemented or uncemented. Cemented is like a cement. You put a cement and fix the cup. Okay. Nowadays we do something called an uncemented, which is more commonly done. Uncemented is just fix the cup and the bone grows into the cup over a period of time. Like the cup, we replace the head also. Okay. So the head is replaced. There are different types of heads for a hip replacement. One is a metal. Okay. Another one is called a ceramic. Okay. So it is like metal. Initially when the hip replacement was found and they started, we used to do something called a metal on metal. Instead of in the cup also there is a metal and the head is also metal. But then it started wearing off and causing a lot of metallosis. So we removed. Now it is done. So most commonly done and which is cost efficient is a metal and poly. Okay. The poly is like polyethylene. The liner is a polyethylene. Okay. In the cup. And then now something we'll do is a ceramic. Okay. Ceramic on and now the one which is lasting longer is a ceramic on ceramic implant. Okay. So these are the methods what we do for a hip replacement.
Okay, so this is how the surgery is done. So how long it takes for a patient to recover from that surgery? What after post surgery?
So post surgery, we start him on all the rehabs. Okay, it might take 1 month to 2 months for the patient to recover completely. That doesn't mean he's bedridden. We make them walk, we make them do all the activities, but gradually patient goes back to his life after around 6 weeks. 6 weeks to 2 months, he goes back to his this thing. As I told you, we would tell them not to do any
Sports, right?
sporting activities from that time. That is the thing. But rest of the normal activities he can do.
Will they be able to walk?
Yeah, they will be able to talk. Otherwise, they
Okay,
won't.
from what day of surgery, sir?
Usually, we make them walk from day one of
Okay,
the
day one.
surgery.
Okay.
Okay. If it is like I told you, there's two options, like a cemented and an uncemented. Okay. If there is uncemented, we might restrict the walking. Like we might ask them to hold a walker or a stick or something for some period of time, because the bone has to grow into it. So we just allow a restricted weight bearing of the something called a restricted, because we don't put full weight. If it is cemented, from day one they walk completely.
Okay. So, sir, you told that the process of osteoarthritis is actually slow. It happens slowly, right? But there is a rare condition called RPOA, rapidly progressive osteoarthritis. So, what about it?
Rapidly progressive osteoarthritis is a very rare condition. Okay, so the literature says that it is almost 7% of the total hip replacement done.
Okay. So, have you
Okay.
encountered any such?
Yeah, so I had a patient who had a fall almost a year back. Okay, she had a fall. She came to me. She had a fractured neck of femur. The neck had broken. There was a fracture. Okay, she came
Okay.
for a fall on the left hip,
Okay.
and then because of her age, she was around 70, and she had other conditions, like she was not very well oriented and all the other conditions. So she underwent a hemiarthroplasty. It's called a bipolar hemiarthroplasty. In the sense, we don't replace the acetabular cup, we replace only the ball and socket. And she was doing fine. Everything was good. After around 3 to 4 months, she had a fall again.
Oh, that's
Okay.
bad.
Yeah, she had a fall and she had a fracture. It's called a periprosthetic. She had a fracture on the same limb which had operated.
Okay.
Okay.
So it's
There was a
it's the same
fracture at the implant site.
Oh.
So it is called a periprosthetic fracture. So then we had to go in, check whether the implant is stable, all that, and then we decided that implant is stable, and then we'll go for a plate. So we put a plate.
Okay.
And everything was fine. She put a plate. She was walking. Suddenly one day, the bystanders came and told me that from last 2 months, patient has stopped walking.
Oh.
She's not walking. So I asked them, what is the problem? Is there a problem on the operated side? They said, no, there's no problem on the operated side. But she's severely complaining pain on the right side.
Okay.
So it was difficult for them to bring the patient up and down. Then I told them, okay, you bring the patient, we'll see. When I took an X-ray, I was shocked to see that the other hip was totally damaged. That means there was severe osteoarthritis of the other hip. Then we started thinking, because 1 year back, that was almost in 8 months or 9 months. Okay, so, and she started becoming bedridden. So she's not walking because she's having total pain on the other hip. So then we had to think why this has happened, because it is a rare condition, so we don't think of that condition very. But if you have that in mind also, it is a rapidly progressive osteoarthritis is an exclusion diagnosis. What do you mean is like you have to exclude everything to say that it is a rapidly progressive osteoarthritis. There's no single test or single thing to diagnose. So because I had X-rays from the last 1 year, and I had series of X-rays taken regularly because she had come for multiple reasons. So I have a series of X-rays, and those X-rays told me that first time the joint was before the fall, or first time when she had a fall, the joint was okay. Second time she had a fall, that time also joint was somewhat okay. But after that, the joint has become damaged. Eventually. So we had to think of lot of other causes. Okay. So we had to rule out whether she has got a TB. There are a lot of changes which are inflammatory causes. Okay, because we were worried that it shouldn't, if there's an inflammation which causes that much damage in this short period of time. If that patient had come first time to me, I wouldn't have thought of so much, because we don't know, because we would have thought it's a normal osteoarthritis. Because I had the previous x-rays, I knew that, okay, there's some problem going on, and to diagnose. In the end, then we got an MRI done. But everything was leading to something called a rapidly progressive osteoarthritis. And she underwent hip replacement. And after that, she started walking. Because the pain was relieved, she started walking.
I
Because
hope
after
she's
that,
okay now.
Yeah, she's okay now. She's okay. She's already traveled to Bombay from here.
Okay, okay,
So, yeah, she's okay. But the problem is, this is a rare condition. Okay. And there are a lot of changes on the x-rays which you can find out. Okay. So if it's a normal osteoarthritis, like I told you, there is something called an osteophyte formation. Okay, the osteophyte formation is like the extra bone which forms due to the cartilage loss and the rubbing of the bone to each other. But in this case, osteophytes won't be there. There will be sudden damage of the head. Okay, it will be asymmetric damage, in the sense it won't be symmetrically damaged, asymmetric joint space reduction, asymmetric damage of the head. And there is something called progressive lateral subluxation, in the sense the joint won't be in its position. It will start moving outside because of the damaged head. That is one of the major difference between osteoarthritis. In osteoarthritis, the joint will be damaged, the circumferential, there will be concentric reduction of the space, and there will be reduction of the cartilage loss, but there won't be a lateral subluxation usually. Okay, so in this, there's no osteophyte, there's lateral subluxation, the head gets damaged very fast, that weight bearing area gets damaged, the bone gets resorbed, all that. So all that led to, told us that, okay, it is something called a rapidly progressive osteoarthritis.
Okay, doctor.
But the treatment is the same. Treatment is a hip replacement.
Okay.
There's no change in the treatment. But the condition is quite rare.
So is there something extra done in that treatment?
No, there's nothing extra done. You have to anyway replace the acetabulum and replace the femoral head as well.
So I understand that RPOA is more serious than osteoarthritis, but for the awareness of people who are watching this, how serious it is?
It is not serious. It's not like a life-threatening condition, but it is a disease which is very debilitating. It's like it will go rapidly, your joint will go into damage, because you don't have time after that. If it's a normal osteoarthritis, difference is this will take. So if it's a normal osteoarthritis, it will take decades, like I told you.
Okay.
It doesn't happen in a day or two. Okay, this can take from 3 months to it can happen within 6 months to 3 years.
Okay, so what's the worst condition of?
So what happened? The joint gets damaged. So it's like they say it's more than 2 millimeter per year damage of the cartilage. 2 millimeter reduction of the cartilage per year in rapidly progressive. So patient will have severe pain. Like this patient, they won't be able to walk. They will have a lot of pain while walking, because it is rapidly going in damaging the joint is getting damaged. So the reason for this, what is told is, first reason is unknown. It's like you don't know what is the major reason. But a lot of other reasons associated is, there can be, the trauma can be a reason. Like cartilage loss can be a reason. Okay, chondrolysis, cartilage loss. So all that can be a reason for rapidly progressive osteoarthritis to begin.
So doctor, what if a patient delays their diagnosis by doing physiotherapy or something?
They'll have to suffer the pain, that's all. The joint keeps on getting damaged. Okay. So one of the difference between knee and the hip is, they say if you have an arthritis of the hip, people will have to undergo hip replacement within a span of 3 to 5 years. But the knee, people keep delaying it, because the mechanism of action is different. Knee runs on a lot of ligaments. The cartilage of the knee is slightly thicker than the hip joint. Okay, and so because of all these reasons, so they delay the knee replacements. And especially in India, people delay knee replacements for a lot of other reasons. So, but the hip is, they say, if patients go into hip arthritis, usually they'll have to undergo the hip replacement within a certain span of time. So because it is, like I told you, it's a debilitating condition. Like you cannot do your normal activities. So you will have to do something because you have a lot of pain. So you cannot walk with pain. You cannot go to your do your daily routine activities with pain. So that is the major condition. So if they delay, so this is what happens. Especially in rapidly progressing, the head gets subluxed. The head goes outside. So every year they say it moves almost 11 millimeter in rapidly progressive. Up to 11 millimeter, the head can get subluxed. So there's a measurement what they do. I don't want to go into detail, but there's a measurement what they do for to measure the subluxation. Subluxation is the joint moves from the away from the joint. Like sublux means the joint is not in its position. It moves away from its position outward, laterally, outside. So it keeps moving outside. So at one point, patient won't be able to put a foot down. Okay, so that was the reason for this patient. So even the patient who what I spoke about, even their bystanders couldn't believe that she didn't have any problem in the other hip. So when I told them there's an arthritis and that is the reason she's not walking, even they couldn't believe because they said, doctor, nothing is there, nothing happened to that hip. She was walking normally. So that is the condition. So at that point, then we had to take a call. Okay. So they thought because of the age, because of the other factors that she's not walking. She was having all the other issues, like she was mentally slightly unstable and she had other family. Okay, yeah. So they thought because of that day she's not walking. So all the other reason they kept on waiting, and then in the end they said, okay, no, because of the pain, she's not able to move the hip also. So after that, because of all that only, she had a second fall after the first surgery. So because they thought, okay, if you do this again, they will again whether she'll be able to walk because they were also not sure because of her condition. But in the end, they took a call. Now she's walking.
So, doctor, when it comes to the success rate of the surgery, how much is it and how safe it is usually?
Yeah. So everyone is scared of surgery. Yeah. So when they come, they are very anxious. Everyone asks how long the hip will last. Okay, so the hips usually last something more than the knees. Okay, so they say around 20 years. Okay, the average, that's studies which tell you around 20 years is around 20 to 25 years is the time with the hip lasts after your hip replacement. Okay, so the success rate is in literature is almost about 95% now. Okay, so there's a 95% success rate for this. So, and the success rate decreases as it goes. So like they say, it's almost 90% up to 10 to 15 years, and after 15 years, it's 80 to 85%. So like that, so it decreases. Compared to the knee is slightly like 10, 15 years, 15 to 20 years, they say and even knee success rates are almost 95% now. Okay, so the safety is actually it's quite safe. Okay, but you'll have to rule out all the other conditions. You'll have to do a lot of blood tests before that. You have to check the patient's systemic things. You cannot just rush into a hip replacement. Okay, even if she comes with severe pain, you have to check all the other metabolic state, whether how is her, if she's diabetic, you have to check whether she's diabetic. It's a multifactorial. So diabetes, even though it doesn't affect directly, but there are a lot of things which diabetic causes, like that causes systemic inflammation increase. It causes high glycemic index, causes neuropathic joints. Okay. Like the joint gets damaged, the nerve gets damaged, so that the reflex of the joint is decreased. Mm-hmm. So all that is what it affects the hip replacement on a long run. Mm-hmm. Okay, the patient loses their reflex, so all that. So they have this neuropathy. They don't know the pain sensation. There is something called the Charcot's joint, where the joint is totally damaged due to diabetes. Okay. Okay, so those are the conditions when it is highly risky to do a hip replacement, because there can be dislocation, there can be other problems if it is. So you have to check the patient thoroughly, to do all the cardiac status, all their physically how healthy they are. Like it's not doesn't mean that only healthy people, because at the age everyone has got the diabetes, everyone is under hypertensive medications, all that. Now all these people undergo hip replacement safely. There's no problem. Only thing you'll have to do your checkups, regular checkups before the surgery. Okay, and then confirm that patient is fit to undergo a surgery, because this is not a like an emergency procedure. Okay, it's very rarely is a hip replacement an emergency procedure. It's an elective procedure. So you can take your time, you can assess the patient, you can do all your workups, and then poster for a hip replacement. Then it becomes a safer surgery.
Yeah. Okay. So, doctor, you mentioned that usually patients are panicked when they come to surgery. So, how do you usually handle that?
So so there is something called counseling. So you
Yeah.
sit with the patient, okay, make them understand what the condition is. So that is very important. Nowadays, no one has time, so that is the biggest problem. So we'll have to make the patient sit along with their bystanders, along with the people who are close to them, make them understand what the condition is first. Okay, make them understand why they're having pain, why why they are not able to walk, or why they are not able to do the daily activities, and the reason for that has to be made. They have to understand why they're not able to do that. Okay, unless they understand, it is very difficult. They won't be satisfied itself. If you force a patient into a surgery, usually they are not very happy. So you have to make them understand, talk to the bystanders, make them understand that okay, this is the reason, and these are and give them the options. These are the options. If it is the final stage or the last stage of osteoarthritis, then only option is hip replacement. Then talk to them, then tell them what are the chances of this going into failure, how long the implant will last. And like I told you, different implants like a metal or a ceramic according to the age. So metal, ceramic is decided according to the age. If it is an older patient around 75, 80 and all, metal implant is enough. Okay, if it's a younger patient, then we go for a ceramic, which is more lasting. So and more lasting, the joint lasts for a longer period of time. So we suggest them, okay, you go for a ceramic. So we tell them what, and show them, if possible, show them videos like how it is done, what is done. But this all takes time. You talk to them and then give them the option to decide. Okay, then let them decide and let them come back to you saying that okay, we need a hip replacement. Then there will be a happy patient. Okay, and then she will be happy by herself because she has taken a decision on her own. She or he, rather than someone pushing her into a hip replacement. But usually hips, they come with a lot of pain, and people after hip replacements are really happy. Compared to the what do you say, the success rate is almost the same in hip and the knee, but hip patients are more happier than the knee patients.
Okay. So awareness is very much important
Very
before
much
the surgery
important,
for a
yeah.
happy, satisfied
Yeah,
patient.
yeah.
Oh, okay.
Even though success rate is so much, people still don't know, they are still scared.
Yeah.
Okay, and they usually don't go to a doctor in India, especially. That
Oh.
is the reason is they think that every time you go to a doctor, they will suggest you a surgery.
Oh, that's
Yeah,
not
so,
the
yeah,
case.
so that is not right. And then they try to get other means of treatment,
Mhm.
all the other means of treatment like chiropractors and all that. They come. So that is an all. So you go to talk to your doctor, explain, and no doctor is going to force you into a surgery.
Yeah.
They'll usually tell and explain to you, okay, these are the conditions. Then it is up to you to decide whether you need it or what are you going to do.
Yeah. As it is an elective surgery.
Yeah, it's an elective surgery. You can take your time. It's not an emergency. You go to the hospital and next day you get operated for a hip replacement.
No, it's not the
No.
case. Okay.
So yeah, so the success rates are quite good world over. The success rate, there are a lot of hip replacement and knee replacement going on now.
And there are happy patients after
There are
that.
a lot of people who are happy because they can get back to your normal day-to-day activities.
Yes.
Okay, and they are, see, as long as you are able to do your activities, all day-to-day activities, doing your work on your own, you are good, because mobility is the key. If you become immobile, get bed bound or bedridden, then the problem starts. Then your whatever diabetes you have or hypertension, everything goes up because your motility is not there. So mobility is the key. In orthopedics, we tend to keep the patient mobile. So we do anything like surgery or anything just to keep all the joints mobile, okay, and keep the patient moving, put the patient back to their feet. That is why all this is done. All this, so much research is going on, so much research on. Every time it is evolving, new implants are coming, new character. There's robotic now, which is going on. So there are robotic surgeries. It's all for the benefit of the patient, so that the patient can take full benefit out of it and lead a like a healthy life, like a happy life after this.
So, what is that message, sir, that you would like the viewers to remember about hip health?
The one message, it's not the one message, it's like not only about the hip health. Any joint, you need to keep yourself healthy. Need to keep yourself active, have good nutrition, have good lifestyle. Try to reduce weight, not put more strain on the joints, to keep your joints happy and healthy, and indeed, indirectly, or you will lead a happy life and you will be active throughout. Keep yourself active. That is the only thing I have to tell you.
Okay, doctor. So, thank you so much for joining us. It was wonderful talking to you.
Thank you.
I think the viewers are also clear about everything about hip health and the surgery. So, thank you so much, doctor.
Yeah.
Thank you.
Thank you. Thank you for having.
Voices shaping the future of medicine. Stories, knowledge, experience. More for life.